Hello, everyone. Bonjour à tous. Welcome, and thank you for participating in today's technical briefing, which will provide an update on the COVID-19 vaccine rollout in Canada. Bienvenue au briefing technique afin de
Welcome
donner
to
une
the
mise à
technical
jour sur la
briefing
distribution des vaccins contre la
on Canada's
COVID-19 au
COVID-19
Canada.
vaccine rollout.
Today, we will hear remarks from Dr. Howard Njoo and Brigadier General Krista Brodie from the Public Health Agency of Canada. They will be accompanied by Joëlle Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions de
Today, we will
Dr.
hear
Howard
from
Njoo
Dr. Howard
et du
Njoo
Brigadier Général
and Brigadier General Krista
de la
Brodie
Santé publique
of
du
the Public
Canada.
Health Agency of
Ils seront
Canada.
accompagnés
With
par
them
Joëlle
today
Paquette
is
de
Joëlle
Services
Paquette
publics
from
et
Public Services
Approvisionnement
and
Canada pour la
Procurement
période de
Canada
questions.
for the question
Following
period.
the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. Njoo.
Thank you, merci. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Brigadier General Krista Brodie, Vice President of Operations and Logistics at the Public Health Agency of Canada. To assist us in answering your questions, we have with us Joëlle Paquette from Public Services and Procurement Canada. This week, once again, we're seeing impressive numbers in vaccine coverage. As of today, over 22 million doses have been administered, and as of May 22nd, more than 57% of the population in Canada aged 12 and older has rolled up their sleeves. You'll notice I said 12 and older. This figure now includes the new eligible cohort of those aged 12 to 17. We are progressing towards the first milestone we outlined in our roadmap a couple of weeks ago. That is, 75% of those eligible for vaccines have 1 dose and 20% have 2 doses or are fully vaccinated. By continuing this momentum, we can look forward to small outdoor gatherings with family and friends this summer. In fact, we've already begun to see some provinces and territories with their public health authorities implementing plans to lift certain restrictions in their regions. As of May 21st, there have been 5,989 reports of adverse events following immunization. These include any medical event that occurs following immunization but isn't necessarily related to the vaccine. 1,126 of these reports, about 1 in 18,000 doses administered, were considered serious, such as a severe allergic reaction. As of May 24th, there have been 41 reports of blood clots with low levels of blood platelets following immunization in Canada, with the AstraZeneca or Covishield vaccines reported to the federal level. Of those, 27 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia, or VIT. Laboratory testing on the remaining 14 individuals is ongoing. Among confirmed VIT cases, sadly, 5 deaths have been reported. We offer our most sincere condolences to the families and friends of those who have passed away. We continue to take these reports of side effects to vaccines, however rare, very seriously, and we consider these carefully when looking at the vaccine portfolio in Canada. It's important to remember that the vast majority of COVID-19 vaccine side effects are minor and resolve within a few days. It's quite possible to have a sore arm, fatigue, aches, or even a mild fever after your vaccination. Don't hesitate to ask a healthcare provider if you have any concerns about symptoms after receiving your vaccine. This week is both Paramedic Services Week and Indigenous Awareness Week. I'd like to first express my gratitude on behalf of all Canadians for paramedics' sacrifices and service on the front lines, particularly over this past year in the face of COVID-19. And secondly, I want to acknowledge the outstanding leadership that Indigenous communities and leaders have continuously shown throughout this pandemic, and their work encouraging individuals and communities to roll up their sleeves and achieve high levels of vaccination. One example is the Protect Our People MB campaign in Manitoba, which aims to bolster vaccine confidence and uptake among young First Nations people in that province. This campaign uses creative social media messaging and reputable influencers to dispel misinformation and encourage broader awareness of the facts about COVID-19 and the vaccines. Grassroots efforts like these build trust, and help protect Indigenous peoples and cultures and are essential to Canada's vaccination efforts. Let's all take inspiration from these leaders and reflect on what we can do in our own communities to make sure every eligible person gets a shot at being protected from COVID-19. Thank you. Bonjour tout le monde. Merci de vous joindre à nous aujourd'hui pour cette séance d'information technique sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis ici avec Madame la Brigadier General Krista Brodie, vice-présidente de la logistique et des opérations à l'Agence de la santé publique du Canada. Pour nous aider à répondre à vos questions,
to assist us in answering your questions, we have with us Joëlle Paquette from Public Services and Procurement Canada.
Cette semaine, nous
This week,
observons une fois de
once
plus des
again,
chiffres de
we're seeing
couverture vaccinale
impressive
impressionnants.
numbers in
En
vaccine
date
coverage.
d'aujourd'hui,
As
plus
of
de 28
today,
millions de
over
doses ont
22
été
million
administrées
doses
et en
have
date de
been
22 mai,
administered,
plus de
and as of May
57% de la
22nd, more than
population
57% of the
canadienne de 12 ans
population in
et plus
Canada,
a relevé
12 years
sa
and
manche.
older, has rolled up their
Oui, j'ai
sleeves.
bien dit 12
You'll
ans et
notice I
plus,
said 12
car
and
ce
older.
nombre inclut
This figure
maintenant
now
la
includes the
nouvelle
newly
cohorte
eligible
admissible
cohort
de
of those
12 à
aged
17
12
ans.
to 17.
Nous nous approchons du
We
premier
are
jalon
progressing
fixé il
towards
y a
the
quelques
first
semaines dans
milestone we
notre feuille de
outlined in
route,
our roadmap a
soit
couple
que
of weeks ago. That
75%
is,
des personnes admissibles à la
75% of those
vaccination
eligible for
aient reçu une
vaccines have
première
one
dose
dose,
et que 20%
and
de
20%
celles-ci
have
aient
2
reçu 2
doses
doses
or
ou
are
soient
fully
pleinement
vaccinated.
vaccinés. En poursuivant sur
By
cette
continuing this
lancée, nous
momentum,
pouvons
we can
espérer
look
tenir de
forward to
petits
small outdoor
rassemblements
gatherings
extérieurs
with
en
family and
famille et
friends
entre
this summer.
amis cet été. En fait, nous
In
voyons
fact,
que les
we have already
autorités de
begun to
santé
see
publique
some
des quelques
provincial
administrations
and territorial
provinciales et
public health
territoriales
authorities
ont déjà mis en
implement
œuvre
plans
des
to
plans
lift certain
d'assouplissement de
restrictions
certaines
in their
restrictions
regions.
dans leur région. En date de 21 mai,
As of May 21st, there have been 5,989 reports of adverse events following immunization.
Ces cas incluent
These
tous les
include
incidents
any
médicaux
medical
se
event that
produisant
occurs
après la
following
vaccination, qu'ils
immunization,
soient ou non
but
liés au
isn't
vaccin.
necessarily related to the
Parmi ces
vaccine.
signalements,
1,126 of these reports, about 1 in 18,000 doses administered, were considered serious, such as a severe allergic reaction. As of May 24th, there have been 41 reports of blood clots with low levels of blood platelets following immunization in Canada with the AstraZeneca or Covishield vaccines reported to the federal level. Of those, 27 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia, or VIT. Laboratory testing on the remaining 14 individuals is ongoing. Among confirmed VIT cases, sadly, 5 deaths have been reported. We offer our most sincere condolences to the family and friends of those who have passed away. We continue to take these reports of side effects to vaccine, however rare, very seriously. And we consider these carefully when we look at the vaccine portfolio in Canada. It's important to remember that the vast majority of COVID-19 vaccine side effects are minor and resolve within a few days. It's quite possible to have a sore arm, fatigue, aches, or even a mild fever after your vaccination. Don't hesitate to ask a healthcare provider if you have any concerns about symptoms after receiving your vaccine. This week is both Paramedic Services Week and Indigenous Awareness Week. I'd like to first express my gratitude on behalf of all Canadians for paramedics' sacrifices and service on the front lines, particularly over this past year in the face of COVID-19. And secondly, I want to acknowledge the outstanding leadership that Indigenous communities and leaders have continuously shown throughout this pandemic, and their work encouraging individuals and communities to roll up their sleeves and achieve high levels of vaccination. One example is the Protect Our People MB campaign in Manitoba, which aims to bolster vaccine confidence and uptake among young First Nations people in the province. This campaign uses creative social media messaging and reputable influencers to dispel misinformation and encourage broader awareness of the facts about COVID-19 and the vaccines. Grassroots efforts like these build trust and help protect Indigenous peoples and cultures, and are essential to Canada's vaccination efforts. Let's all take inspiration from these leaders and reflect on what we can do in our own communities to make sure every eligible person gets a shot at being protected from COVID-19. Thank you. And now I invite Brigadier General Krista Brodie to deliver her remarks.
Good afternoon. To date, we have shipped more than 26 million doses of COVID-19 vaccines across Canada, more than 5.1 million last week alone. This week, the team at the National Operations Centre coordinated the distribution of the remaining 600,000 doses of Pfizer-BioNTech from this week's allocation. Moderna shipped us an additional 100,000 doses with last week's shipment, doses that are currently being distributed, bringing this week's total to more than 700,000 doses. Looking ahead, we expect weekly shipments of 2.4 million Pfizer-BioNTech doses per week in June and close to 2.3 million doses weekly in July. Moderna has confirmed delivery schedules for the next shipment, which include 500,000 doses expected to arrive next week in two parts. The initial shipment is expected to arrive in the country early next week, while the second shipment is expected to arrive over the weekend, next weekend, with distribution occurring the following week. The next confirmed shipment for 1.5 million doses is set to arrive in country mid-June. We expect Moderna to continue to ramp up its deliveries in the second part of June, with millions of additional doses to be delivered. In addition to Pfizer-BioNTech shipments, Canada is set to receive close to 3 million doses next week. We are continuing to work with stakeholders to ensure sufficient supply of AstraZeneca for second doses. We continue regular discussions with the provinces and territories, with a particular focus in the coming weeks on ensuring that capacity to administer vaccines is aligned with vaccine availability. With the confirmed shipments of Pfizer-BioNTech and positive indicators from Moderna this week, we are well on our way to distributing more than 40 million doses by the end of the second quarter. Across the vaccine rollout enterprise, at all levels and in all departments and jurisdictions, people are working relentlessly to ensure that Canadians can be vaccinated safely and as soon as possible. Thank you. Bon après-midi.
Good afternoon. To date, we have shipped more than 26 million doses of COVID-19 vaccines across Canada, more than 5.1 million last week alone. This week, the team at the National Operations Centre coordinated distribution of the remaining 600,000 doses of Pfizer-BioNTech this week. Moderna shipped us an additional 100,000 doses with last week's shipment, doses that are currently being distributed, bringing this week's total to more than 700,000 doses. Looking ahead, we expect weekly shipments of 2.4 million Pfizer-BioNTech doses per week in June and close to 2.3 million doses weekly in July. Moderna has confirmed delivery schedules for the next shipment, which include 500,000 doses expected to arrive next week in two parts. The initial shipment is expected to arrive in the country early next week, while the second shipment is expected to arrive over the weekend, with distribution occurring the following week. The next confirmed shipment for 1.5 million doses is set to arrive in country mid-June. We expect Moderna to continue to ramp up its deliveries in the second part of June, with millions of additional doses to be delivered. In addition to Pfizer-BioNTech shipments, Canada is set to receive close to 3 million doses next week. We are continuing to work with stakeholders to ensure sufficient supply of AstraZeneca for second doses. We continue regular discussions with the provinces and territories, with a particular focus in the coming weeks on ensuring that capacity to administer vaccines is aligned with vaccine availability. With the confirmed shipments of Pfizer-BioNTech and positive indicators from Moderna this week, we are well on our way to distributing more than 40 million doses by the end of the second quarter. Across the vaccine rollout enterprise, at all levels and in all departments and jurisdictions, people are working relentlessly to ensure that Canadians can be vaccinated safely and as soon as possible. Thank you.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We'll start with the first question. Première question, opérateur.
Thank you. Merci. Our first question, notre première question, is from Mia Robson with the Canadian Press. Please go ahead. À vous la parole.
Yes. Hi. Good afternoon. I'm wondering if you could, either Dr. Njoo or Brigadier General Brodie, if you could talk about the idea of second doses. There's more calls to move faster to second doses. You said that you want 20% of people to have that second dose before we can look at opening up. But at the current rate, we're months away from getting there. I'm just wondering if you think it's time to start moving towards second doses, also in light of the new study out of the UK on how well first doses are working against variants.
It's Dr. Njoo. Maybe I can start from the public health perspective, and then Brigadier General Brodie can certainly speak to the logistics. From what we're seeing, certainly talking to, quote, my counterparts in the provinces and territories, it's already starting to happen in terms of offering second doses to, in many ways, starting again with the priority groups that were offered the first doses. So we're seeing it, I think, with appointments being moved up in terms of getting that second dose. So it's happening. Obviously, the plans are being modified in the provinces and territories based on the availability of vaccine. And certainly we're seeing that the more and more people are getting that second dose. So I think we have moved steadily. I think we're somewhere in the neighborhood of sort of 5% or so of the population overall having received sort of the two doses. And that number, I think, will be going up. And certainly for the first dose, we're well over 50%. It's, I think, even 60% or so if you're looking at the population 18 and over. It's about 62%, I think, the last figure I've seen. So everything's trending in the right direction, and we get it. And in the provinces and territories, and NASA has also said that you should be trying to vaccinate to now. Sort of obviously, 16 weeks was the outer limit, but certainly if you can do it sooner, that's the way to go, and that's what the provinces and territories are now undertaking. Thank you.
Brigadier General Brodie here. From a supply perspective, certainly the numbers that we're seeing in terms of confirmed deliveries through the end of June and into July would indicate that there are sufficient doses available for first doses, as well as concurrency and second doses, and that capacity will just continue to grow over the summer. Thank you.
Thank you. But Dr. Njoo, just going back to the concerns raised from that study that came from Public Health England this week that suggests first doses aren't as effective against the variants, the B117, but more particularly the B1167 variant. If we have concerns about that, and I've just seen a lot more calls from infectious disease specialists and doctors saying that older Canadian seniors also are sort of ending up in hospital after just one dose because they're not as protected, and maybe we're not moving as fast. I mean, yes, it's starting, but we're still very far behind on second doses. Is it time to really start to speed that up?
Yes, it's Dr. Njoo. Yes, I think we are speeding up. I think if you look at obviously data from around the world, that there's different studies you can look at. I think overall here in Canada, we're seeing a very positive impact. We're looking at the rates of illness, infection, hospitalization, deaths among the older age cohorts that obviously were among the first to receive that first dose, and then also many of them getting their second dose, especially in nursing homes. And we're seeing that the morbidity and mortality have dropped. So there is obviously a positive impact. You're right. I think that overall, when you speak about the variants, the vaccines are effective. Certainly there might be a bit of a drop off. There's no vaccine that's 100% effective, but I think it just speaks to the point that we need to vaccinate as many Canadians as quickly as possible. And also the fact that with the variants, we can't let go of the public health measures. I know it sounds like a broken record, but it's sort of a two-pronged approach, right? It's vaccinate as quickly as possible, as many Canadians, but at the same time, you can't let go of the public health measures. And as we're seeing with various provincial, territorial sort of reopening plans, they certainly, I think, recognize you need to take into account what's happening on the ground in terms of community transmission, and obviously as lagging indicators of what's happening with their healthcare system. Because I think really what we're all trying to avoid is the fourth wave and certainly overloading our healthcare system yet again. So I think it just speaks to the importance of both maintaining the public health measures, both at a community level and individually, and then getting as many Canadians vaccinated as quickly as possible. Thank you.
Thank you, Dr. Njoo. Prochaine question. Next question.
Thank you. Merci. Our next question. Notre prochaine question is from Christian Noël avec Radio-Canada. Please go ahead. À vous la parole.
Bonjour, mesdames, messieurs.
Good afternoon.
Écoutez, j'ai une question
I
assez
have
claire, je
a
pense.
question that I think quite clear, and I'd like to get a clear answer if
Avec
possible.
Moderna, on
With
semble avoir des
Moderna,
problèmes
we
d'approvisionnement.
seem to have
On nous
supply
dit, vous en
problems.
faites pas, on va avoir assez de doses pour la première
We
dose.
don't
Je le comprends.
seem to have
J'essaie de
enough for the
comprendre
first
quel est le
doses
problème
in the beginning.
présentement
So
avec Moderna.
what is the problem currently with Moderna?
Merci pour la question.
Thank you for the
Il n'y a
question.
pas un problème
There isn't
tel quel
a
avec
problem as
Moderna.
such with
Comme
Moderna.
on avait mentionné au mois
As we
d'avril,
mentioned in the month of April,
il y aurait des turbulences avec leur
there had been
avec les
some
livraisons
difficulties with
parce
their
qu'ils
deliveries
travaillaient sur augmentation de la
because they were
production
working
de
on
leur
ramping up
vaccin dans leur
their
manufacture.
production
Donc, il n'y a pas un
of the
problème
vaccine in
comme
their
tel,
plant. So
c'est seulement
it's not a problem
certaines
as such.
difficultés qu'ils ont eu
It's just
à
certain
augmenter
difficulties they
leur
had
production
in their efforts to increase their
pour être capable de
production
livrer
in order to
plus
be
de
able to
doses
deliver more doses
dans les délais qu'on s'attendait.
within the time frames
Merci.
that we expected. Thank you.
Merci.
Thank
J'aimerais
you.
aussi savoir
I'd also like to know
le nombre de doses qui
the number of doses
arriver à
that
leur date de péremption.
might be
Est-ce qu'on a une idée de
here
à quoi ça ressemble,
before
où
they
elles se trouvent
expire.
et comment
I
est-ce qu'on a
wonder,
un plan pour essayer de maximiser
do
ça
we
entre les
have a
provinces pour
plan
s'assurer
to
de ne pas perdre
maximize their
de doses
use
qui
among the
s'approchent de leur
provinces
date de
so
péremption?
we don't lose any doses just through expiration?
Je crois que vous parlez des doses
I think you're
d'AstraZeneca.
referring to AstraZeneca doses.
C'est bien ça, merci.
That's right. Thank you.
Donc, je vais demander
Well,
à
then
Général
I'll
Brodie
ask
de
General
répondre à la
Brodie
question.
to answer that question.
Donc, on est en train de travailler
We are
très proche
working
avec
very
les provinces
closely with the
et pour
provinces
s'assurer
in order to
qu'ils
ensure
pourraient utiliser
that they will
toutes
be able to
les doses
use every
où il
dose
a maintenant pour
that they have in
vacciner
hand
les,
now to vaccinate people,
Canadiennes que
as many
possible.
Canadians as possible.
Si il y a des,
And if
des inquiétudes avec les
there are any
dates
concerns
d'expiration,
regarding expiry
peut-être
dates,
on peut faciliter la coordination entre les
perhaps
juridictions pour
we will be able to
partager les
tighten up
doses,
coordination
pour
between
s'assurer qu'ils
jurisdictions
pourraient les
to
utiliser en
ensure that
accordance
those
avec leur
doses will
plan
all be
de
able to be
vaccination pour
used
les deuxièmes,
under
pour
their
maximiser les
vaccination
deuxièmes
plans
doses
to
avant
maximize
de
second
date
doses
d'expiration. Donc,
before those
on est en train
doses
de
expire. So we are
communiquer
communicating
avec
with the
toutes les
provinces
juridictions pour
and
maximiser le
territories in order
usage
to
des
maximize the use
AstraZeneca.
of all
Merci.
AstraZeneca doses. Thank you.
Merci.
Opérateur, prochaine question. Next question.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Marika Walsh with the Globe and Mail. Please go ahead. À vous la parole.
Good afternoon. I think my question is for Madame Paquette. I'm wondering if you can explain to us, or if you can tell us what Moderna's explanation is for not being able to give that full delivery schedule that the government asked for last week. Last week, we were told that the government was pushing for a precise delivery schedule for June and July. And in response, Moderna has given a schedule for the next 3 weeks that does not account for the full target for Q2.
Thank you for the question. We're actually continuing to work with Moderna to firm up its delivery schedule. It was announced today that they will have 2 shipments next week for a total of 500,000 doses, as well as a shipment the week of June 14th for 1.5 million doses. And we expect to be in a position to provide further detail in the coming weeks on additional doses in June. So, you know, we're providing the information we have as it comes available. Thank you.
Okay, my question was why they're not able to give the full schedule. So I don't know if you can explain that. But my second question is for Brigadier General Brodie, I believe, or if somebody else wants to weigh in, maybe Dr. Njoo. You're talking about how Canada is hitting these targets on percentage coverage. Can you tell us what your projections show for when specifically Canada will hit that 75% first dose target and 20% second dose target?
So on the first question, what we would like to provide you is firm information on the delivery schedule of Moderna. And that is what we are giving to you when we have that information available to us. And that is how we will continue to provide this information. Thank you.
It's Dr. Njoo. I could probably start in terms of the second question. So certainly we've indicated, quote, at a sort of a pan-Canadian or national level, these, I would say, in some ways, aspirational targets of a 75% of Canadians being offered and hopefully accepting that first dose, and then 20% having received 2 doses as a point at which obviously you can seriously start looking at the sort of lifting certain public health measures. But obviously it depends on the local situation, as we've indicated before, what the level of community transmission and more importantly, what the strain might be on the sort of the healthcare system, both at a very local and regional level, and then of course at a provincial level. Each of the provinces and territories are obviously really pushing forward, and they're at, I would say, similar stages in terms of their vaccine rollout, but it's hard to say for the country as a whole because, you know, one jurisdiction may hit a certain level of vaccine coverage before another. So I don't think it's easy to sort of give an overall date for the country as a whole. I think you're probably best placed to ask or look at each of the individual provinces as they move ahead with their individual vaccination programs. Thank you.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque with La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Ma première question, je crois, serait pour Madame Paquette. Si je me trompe pas, on devait avoir une livraison de Johnson & Johnson au mois de juin. Je me demandais qu'est-ce qui arrive avec cette livraison-là. Est-ce qu'elle a été cancellée vu la situation actuelle ou est-ce qu'elle est toujours prévue?
Is that still planned for?
Merci pour la question. Comme vous savez, nous avons reçu 310,000 doses de Johnson & Johnson
doses earlier.
Et ces doses sont toujours avec nous en attendant l'approbation de Santé Canada.
As we await approval from Health Canada.
And les livraisons supplémentaires de Johnson & Johnson seront confirmées une fois que nous aurons plus de détails sur la confirmation de Santé Canada sur même les doses de 310,000
even on those 310,000 that are already in the country. Thank you.
OK. Oui, donc est-ce que donc, j'en comprends que les livraisons sont suspendues. Si vous pouviez juste
if I understand correctly, deliveries have been suspended, if you could confirm that. And secondly, I have a question for Brigadier General Brodie.
Je comprends qu'il y a toujours
I understand that there's still a lot of uncertainty surrounding Moderna, but I think what we'd like to know is if you can confirm at this point in time that we won't have 48 to 50 million doses by the end of June. Is that the situation?
Merci pour la question.
Thank you for the question.
Les doses de Johnson & Johnson ne sont pas suspendues. Nous
deliveries are not suspended.
De Santé Canada.
We just are waiting for that Health Canada confirmation, and also from Johnson & Johnson for the delivery of doses that are part of our agreement with them, which would be 10 million doses.
Le 10 millions de doses.
Now,
je vais passer la parole à Madame
Générale to Brigadier General Brodie for the other part of the question.
Donc, on a les livraisons confirmées pour
the confirmed deliveries for 40 million
vers la fin de mois de juin.
By the end of the month of June is what we have, and we'll add to that number with each confirmation that we receive
avec les nouvelles des prochaines livraisons.
with
Donc
the
maintenant,
further
avec
deliveries. So
les livraisons confirmées pour
with the
Moderna
confirmed
et pour
deliveries for
Pfizer,
Moderna and Pfizer,
on va atteindre
we will reach
40 millions de doses
40 million
vers la
doses
fin de la mois de
towards
juin.
the end of the month of June.
Merci.
Thank you.
Merci beaucoup. Prochaine question. Next question, please.
Thank you. Merci. Our next question. Notre prochaine question is from Ryan Tumulty with the National Post. Please go ahead. À vous la parole.
Yeah, hi. I wanted to ask about the Moderna shipments. Even with the doses announced today, the company is still just over 6 million doses short of where it is supposed to be by the end of June, by the end of the second quarter. I'm wondering if you have confidence in their ability to make up that 6.6 million dose gap between mid-June and the end of June.
Thank you for the question. I can confirm that Moderna is committed in providing doses to Canada as soon as possible, and we continue to work with them to firm up their delivery schedule for June. Thank you.
Yeah, I guess just as a follow-up then, I'm wondering, given Moderna's so far inability to provide you, to stick to that schedule, and given that we're giving out so many Pfizer doses as first doses, are we considering exercising any of our options for additional Pfizer doses so that they are available for future second doses if so many of our first doses are going to be Pfizer?
Thank you for the question. As mentioned, we're continuing to work with Moderna to firm up their delivery schedule. We are confident that they will meet delivery schedules with Canada, and so I can't confirm whether or not other discussions are happening or speak to other discussions that may be happening with other suppliers. At the moment, we're looking at over 2.4 million doses per week from Pfizer, and we're looking at between now and mid-June, 2 million doses from Moderna, and we're expecting additional doses from Moderna before the end of June. And as mentioned, once we have that firm commitment, we will be providing that information. Thank you.
Merci beaucoup. Prochaine question. Next
I can
question.
offer.
Thank you. Merci. Our next question, la prochaine question, is from Tom McCharles with the Toronto Star. Please go ahead. À vous la parole.
Thanks. Just before I ask my question, I think General Brodie wanted to weigh in on that last part. So before I ask my question, General Brodie, if you wanted to just add your bit there.
Thank you. I can just offer that from a logistics and delivery perspective. We're working very closely with the provinces and the territories to ensure that we have the capacity in the system to be able to ramp up to meet the increased demands or the increased shipments whenever they arise in the system over the coming months. So aligning that administration capacity for vaccines and vaccination programs with the supply is a real concerted effort that we are continually discussing and working with the provinces and territories on to ensure that we have the capacity to move as many vaccines as become available as quickly as possible into the arms of Canadians. Thank you.
Thanks. My question is for you, I guess, General Brodie. According to the federal numbers, you've distributed, you say, I guess, 26 million across the country. Some 10 million doses have been delivered to Ontario, and only 8.5 million administered. Do you have a clear idea what's going on with the other 1.5? Is it just a matter of a slow rollout? Is that because most of those doses are AstraZeneca being withheld? It's just not clear to me what's going on there. Can you give me your thoughts on what's going on there?
Certainly, I won't speak on behalf of the provinces with respect to their vaccine distribution programs, but I can indicate that we work very closely on a day-to-day basis, coordinating the vaccine supply and working with the provinces to ensure that they have the supply they need in order to support their programs. Thank you.
The question about when Canada hits that target of 75 first dose, 20% having second dose, I want to ask it not in terms of when will people have those doses in arms, but I'm asking, what is the date at which you are now projecting that there will be enough supply in Canada for that target to be met? In other words, when will you, Ottawa, bring in enough that have brought in enough vaccine to have met the target, given the ages that are approved for vaccination, to hit the 75-25 target or 75-20 target?
We have confirmed shipments
I'm sorry, I just want to be very clear here. The Prime Minister has already said that is the number that he's using when it comes to looking at the border reopening. So is there a date by which at least that number in terms of supply can be hit?
So we have confirmed deliveries for upwards of 40 million doses by the end of June and upwards of 50 million doses for the end of July. Now it's up to the provincial and territorial jurisdictions to roll out their vaccination campaigns in accordance with their best needs. But certainly from a supply perspective, we have confirmed forecasts for 40 million doses in the country by the end of June and 50 million doses in the country by the end of July, working on today's numbers. Thank you.
Thank you. Merci. Our next question, notre prochaine question, is from Peter Cohen with CBC Newfoundland. Please go ahead. À vous la parole.
Newfoundland and Labrador has taken 1,400 doses of AstraZeneca that are set to expire at the end of the month and has sent them back to the federal government. What's going to happen with those doses?
So we're working across jurisdictions right now to ensure that as many of those doses as absolutely possible can be used to vaccinate Canadians, particularly in those jurisdictions that are moving forward with their second dose AstraZeneca administration plans. And should we arrive at expiry dates, then remaining doses will be will be disposed of in accordance with public health best practices, and we'll report those centrally and monitor that closely to ensure that we're maximizing the number of doses that are used to immunize Canadians.
And aside from Newfoundland and Labrador, how many other provinces have said that they are going to repatriate doses, and how many doses are you expecting to have returned?
So we don't report on specific provinces and territories in that regard, and because there is still time before those first doses expire, there are active efforts to ensure that as many of them get used as possible. So once we roll past expiry dates and are in a position to report, then by all means we'll do so in the spirit of transparency. But at this time, we're still rolling towards the first of the AstraZeneca expiry dates of concern. Thank you.
Thank you.
Merci. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Brian Mullen with Global News. Please go ahead. À vous la parole.
Thank you. Following up on Mia's question regarding intervals for second doses, NACI has approved a 16-week interval. Provinces are each making their different decisions. By how much do you think the provinces should be shortening the gap? With the increase in vaccine deliveries, do you think we could get it down to the manufacturer recommended 3 to 4 week gap?
It's Dr. Njoo. Maybe I can answer that question in part. And it's interesting that the way you've put it, obviously, if you look at the original product monograph for let's say the AstraZeneca vaccine, it was 4 weeks. Then obviously you look at the UK and they increased the dose interval. Obviously, with the same kind of strategy approach as Canada with an extended dose interval to try and vaccinate as many people as quickly as possible to 12 weeks. And in Canada, as you know, NACI has said that the dose interval could be extended up to 16 weeks, but certainly could be then shortened depending on getting more vaccine into the country. The UK, as you know, has now also done studies to look at what the effect is of increasing that dose interval, and they've actually found that the actual immune response is greater among those that have had a longer dose interval, up to 12 weeks compared to the original manufacturer, sort of a product monograph saying 4 week interval. So I think someone maybe ironically now people are saying, "Whoa, okay." So now that the real world experience shows that an increased dose interval is actually better in terms of an immune response. How much shorter could or should we make it, as you say, to get closer to the product monograph? I think in Canada, the province and territories are obviously looking at the same sort of evidence that we're seeing from around the world, from other countries' experience. I think Ontario and so on, other provinces are looking at maybe 10 weeks. I think probably a minimum is that maybe down to 8 weeks. So based on the science and then what we know about the dose interval, that appears to be where the provinces are now moving towards in terms of, you say, decreasing the dose interval. At this point, I don't anticipate that provinces may go lower, but obviously as the science continues to evolve and more data becomes available, that could certainly be modified as well. Thanks.
Thank you. Merci. Our next question.
Sorry, I do have a follow-up. Dr. Njoo, on a separate matter for my colleagues in Alberta, could we get your reaction to the Alberta reopening plan? Stage 3 is linked to first shot of vaccination only. Is that a concern? And do you have any concerns about provinces reopening too quickly?
Thank you for the question. I think, certainly among the public health community, speaking with Dr. Dina Hinshaw and our counterparts across the country, I think we're all on the same page. We're certainly recognizing that we need to be prudent, and if there are sort of reopening plans, they need to be done in a very, I think, thoughtful, sort of a stepwise fashion that is linked not just to vaccination rates and vaccine coverage, but also to what's happening, as we always have referred to in terms of the indicators with respect to community transmission and certainly by extension of what's happening with the healthcare system. We know that community transmission in some ways is linked with the lagging indicators, and I know in Alberta they're very seized with the issue in terms of not overloading their healthcare system, which obviously I think is a priority as well in the other provinces, territories across the country. So I would say that looking at the Alberta plan, it talks about vaccination rates, but I think we need to also appreciate that underneath that, you need to also very carefully follow the epidemiology, very carefully follow what's happening in terms of obviously hospitalizations and sort of severe outcomes as you're tracking vaccine coverage. So it's not just about the vaccine coverage alone, as we've said multiple occasions, but also looking at what's happening in the community. And even then, I would say that within any given province, it's not for the province as a whole, but really at a more granular local level, because let's say in an urban area, be it a Calgary, Edmonton, it might be a different reality compared to maybe a more rural setting. So I think that's what we certainly anticipate our provincial colleagues are doing in the province of Alberta and also across the country in other provinces and territories. Thank you.
Thank you. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Tom Perry with CBC News. Please go ahead. À vous la parole.
Hello. Thanks for taking my question. My question is for Dr. Njoo. Dr. Njoo, I'd like to ask you about the Olympics. Japan's doctors union says it's worried that the Olympics could spread current variants of COVID-19. It could also even create a new variant, bringing all these athletes and trainers from all over the world together in Japan. I'm wondering what you think about those concerns and whether you still think it makes sense for Canada to send athletes to the Tokyo Games.
Thank you for the question. I think I'll just speak from a public health perspective. Certainly what you're mentioning in terms of the physician scientists in Japan, I think I understand, respect that, because obviously anytime you get groups of people congregating together, even let's say the athletes in a bubble, there is obviously the chance of interaction and potentially and transmission and spreading of the virus. Having said that, certainly my understanding is that countries that are sending delegations are making their best efforts to vaccinate the athletes, and certainly if there's a high level of vaccine coverage, and it's obviously athletes coming in and out under tightly controlled conditions, just maybe coming in for their event and then leaving, and so on and so forth, that certainly that the public health risk can be mitigated. It's never zero, but certainly it can be mitigated. So that's sort of the technical public health response. In terms of the question of whether, could or should the Olympics be held at all, I think that's obviously a question for others beyond myself, because that obviously involves other considerations than purely the public health aspects. I would say that here in Canada, I think we're quite excited. We just had a discussion with the Canadian Olympic Committee as well as the Paralympic Committee, and certainly Canada's plan at the present time is to send our athletes over, and with the expansion of obviously the eligibility for Canadians now to the age of 12, as well as the supply that we have in the country, plus the fact that I understand Pfizer's given actually an offer of vaccine for the athletes, that I think it's a great opportunity to offer the vaccine to these individuals, because they're like any other Canadian, obviously, based on age alone. And I think they would be great role models as well if they were to obviously go forward, get vaccinated, fully vaccinated before they go, to show other young Canadians that, hey, they realize and recognize the importance of getting vaccinated. So that's all I'll say in terms of the public health aspects. To the other point about the Olympics and whether they could or should be held, obviously there's lots of other factors beyond what I could comment on. Thank you.
my other question then, I guess it has to do with, I guess, people traveling, whether for the Olympics or other reasons. As we get more Canadians receiving their second dose of vaccine, whatever vaccine they get, if Canadian travelers are fully vaccinated, are they still going to have to quarantine when they come back into this country?
At the present time, that's certainly the stance with respect to the requirements for any incoming traveler, regardless of vaccination status. I think I've mentioned before some of the technical aspects, but I would say that it's a live issue, and we recognize that. In terms of travel documentation, which obviously is a federal responsibility, be passports, or even the fact that for many countries you need a certain certificate, let's say for yellow fever vaccine, in order to go to certain countries. That principle has been well established. We recognize, and we certainly, I think, at different levels are working with other governments around the world to standardize and get a sort of a consistent approach, even in terms of some of the technological aspects of working with, for example, civil aviation authorities and so on, so that Canadians would be able to, let's say, if they were to travel at some point, have the same sort of ability to show proof of vaccination that citizens of other countries would have. So that's something that's a work in progress. And as I mentioned before, here in Canada, it's something we're working on closely, because the federal government is responsible for, let's say, the issue of travel documents and what Canadians require in terms of going overseas and coming back. But certainly vaccination per se is obviously the responsibility of the provinces and territories. So there's still work to be done in terms of the vaccine databases, protecting privacy, confidentiality of patient records, etc., versus what might be required and what Canadians could be using in terms of traveling overseas. But that's obviously for a later day. At the present time, we're still obviously recommending that Canadians should not be traveling outside of Canada for non-essential reasons.
La prochaine question sera la dernière. Next question will be the last.
Thank you. Merci. Our last question, la dernière question, nous vient de Alex Boyd with the Toronto Star. Please go ahead. À vous la parole.
Hi, guys. Thanks for taking questions. Probably a question for Dr. Njoo, but wondering if it's possible to get an update on the Janssen shipment. Now that they've been on hold for about a month, just wondering if you can give us a sense of when there might be a decision on those, and also clarify what exactly the concerns are at the moment, whether it's still the manufacturing facility in the States, or whether it's blood clots, or kind of what the specific issue that is being considered right now.
It's Dr. Njoo. I could start, but certainly would defer my colleagues if they have additional information. Really, I have nothing further to offer, because obviously I'm not in the know. It's the authorities at Health Canada. They're looking closely at the situation. The reason for the shipment being sort of, quote, in quarantine, even though it's in country and sitting in freezers, is a sort of a quality assurance program. As I think we've indicated before, it's because of a certain, I think, I say, how do you call it, a product or so, not product, but I can't find the word, something that's used in the vaccine that has come from the facility, the emergent facility in the United States, that obviously has had some quality control issues. And certainly Health Canada continues to work closely with their FDA counterparts, as well as the manufacturer, to look at sort of the issues involved. And they'll make a decision in terms of whether they're satisfied that from a quality assurance point of view, that these particular vaccines and this particular shipment sort of pass sort of their quality assurance protocols before they will release it. But the work's still ongoing, and I have nothing further to offer at this point. So I would pass it on to my colleagues if they have any additional information. Thank you.
No information. Thank you.
Thank you. And
I have no further information.
Oh, sorry. Thank you. Just as a quick follow-up, do we happen to know when those doses expire? Are they the same kind of window as the AstraZeneca doses?
I can speak to that. Those doses are still in their frozen state, so they have a very long shelf life in their frozen state.
Okay, thank you.
C'est ce qui met fin à le breuvage technique d'aujourd'hui. That will be all for today's technical briefing. Merci d'avoir été avec nous. Bonne soirée.